Hey, it's Dr. Allen here at Evolve Chiropractic in Woodstock. We're about to start care here in the office. You just finished your first visit. We've taken our exams, we've done our x-rays, and basically we want to start to put together a customized plan for your case. Now, I want to explain how the office works and how we structure the office as far as the phases of care that you're going to be moving through and what that's going to look like on a day-to-day basis. So basically, you're starting care because you're in some form of discomfort. That's usually the case. So what that means is that we weren't maintaining our body properly. A problem started to occur somewhere in the spine or somewhere in the body, and then eventually that problem turned into a crisis. Crisis is where there's inflammation, there's damage that's occurring, and your body is signaling that there's a problem. And that can be in the form of discomfort. So whether that's sharp shooting pains, dull achy pain, numbness, tingling, headaches, back issues, knee, ankle, whatever that looks like for you, what brought you into the office, that's what we need to take care of first. Once we can get you out of that crisis mode, we'll be able to uncover the underlying problem that's there, and we can start to correct that. And the way that we do that is through different forms of traction, where we start to pull the spine into a brand new position, and we try to balance the body within gravity to take a stress off the nerves, off the discs, off the muscles, and try to balance you as much as possible with gravity. Once we get you into that corrective type phase, which is the longest form, we can then move you into maintenance phase. Maintenance phase is different for everybody. Depending on the stressors that are in your life, you might need to see us once a week, once a month. Some people are somewhere in between there. Some people choose to see us a little less frequent than that, but that's typically what we would advise as far as making sure that the spine is moving in the proper directions that it needs to. All the joints have freedom of mobility, and you're not going to start to creep back into that problem phase, which then would eventually lead you back to the crisis phase. So when we're in the crisis phase, we're basically going to be seeing you 3 to 5 times per week. That's basically a few times a week to daily, every day that we're open. So we want to hit this as hard as possible to make the quickest change that we can in the body. We want to be able to remove inflammation from the body, and we want to restore the range of motion and the function of the body. We do that by using different forms of treatment. So typically we start with some gentle range of motion exercises. We do our chiropractic adjustments where we're training the body that it's safe to move into new directions. We use soft tissue therapies to remove any muscle guarding or spasms that might be underlying in the body. And then we also use different forms of traction, which typically are along the lines of decompression. So we're stretching the body open, we're creating space, we're taking pressure off of the nerves that are sending signals or symptoms down into the limbs or the extremities. Sometimes we might have to use heat, we might have to use ice, we might have to use electric stim to reset muscle tone. We can use ultrasound to move fluid from underneath the surface of the skin and try to get inflammation out of a certain area. We can use cold laser to try to stimulate the body's natural healing responses. We may also have to look at your lifestyle factors. So that could be what you're drinking. Are you properly hydrated? Are you eating foods that are creating inflammation underneath the surface? So we have to look at what you're doing outside the office, not just what we're going to be doing inside the office to create the quickest change as possible. Now, as we start to transition into the problem correction phase, we're going to be basically getting you out of, I hate the word pain, but that's where we're at. We have to get you out of that crisis phase. So we expect a 50 to 75% reduction of the discomfort that you've been in when you started to when we end our crisis phase. Typically, that's going to be about a 2 to 4 week time frame, depending on how long the crisis has been there. Now, as we go into the problem correction, there's really not a lot of discomfort at this point. And what we're going to be doing is pulling the body into a new position. When we look at your x-rays, we're going to show you what a normal position of the spine should look like. We're going to show you where you're at, and our main goal in this phase is to close that gap. So what we want to do is balance your body in space as much as possible to ensure that your brain is connecting into your body and vice versa. So we want to remove any interference with that connection that's preventing your body from functioning the way that it needs to. Once we get through this problem correction phase, which can take anywhere from 3 to 12 months, depending on how severe the damage is or how long the damage has been there, it can take a little bit of while. So you have to take into account ligament and disc repair times, which can be anywhere from 3 to 12 months time. as we move you into the next phase of care, which would be our maintenance style of care. We're basically going to be just moving the body the way that it needs to, relieving any stresses that you've encountered throughout your day. So if you sit at a desk all day, it's important to get the upper back adjusted, low back adjusted. We can adjust into the hips, into the neck. We basically want to remove any areas that are starting to get stuck, starting to lose their ability to move in space, and starting to potentially create that problem of subluxation or restriction of movement at certain segment levels. So this, again, shouldn't be a difficult part. It should get easier as we go through there as far as any discomfort that's associated with the treatment. So once we're in that maintenance phase, again, 1 time a week to 1 time a month, anywhere in between is typically what's recommended. We come in, we do some stretching, we do our adjustments, and you're on your way. So hopefully that explains the 3 phases of care that we do in the office. You'll see everybody doing their therapies, so it's very important that you stretch before your adjustments, that you get the body moving, you get the blood flow going into the body, and the adjustments will be more comfortable. They'll last a lot longer that way. So just make sure that you keep with that flow of that, whatever your prescribed therapies are, and you do those every time you come in. Soreness is always going to be expected within the first couple weeks of care, so make sure you're icing at home in between appointments. And that should give you the best success rate for getting through that first rough phase of care, getting you out of discomfort, and then fixing the problem, eventually getting you into the maintenance phase. Hopefully this takes care of any questions or concerns you might have about care here in the office. Our goal is to make sure that you have the most successful experience here, that you take care of the problem and get you into maintenance phase as quickly as possible. If you do have any questions, feel free to reach me here at the office via email or give me a call at the front desk. I'd be glad to answer any of the questions you have. Be safe, have fun, get at it. I'll be seeing you soon.